I'd like to talk about how to detect lump lesion using ultrasound. We have nothing to disclose. The clinical importance of meniscal lump lesion in patients with ACL tears has emerged. However, the diagnostic accuracy of an MRI for detecting lump lesions is low. So the goal of this movie is to describe in detail the ultrasound technique that we use to detect lump lesion in patients with ACL tears. The patient was placed in the prone position. The semitendinosus tendon is palpated at the medial side of the popliteal fossa at 1 cm above knee joint line. A probe is placed just above the semitendinosus tendon to visualize the semitendinosus tendon and the semimembranosus muscle belly on the short axis view. The appearance resembles a cherry on a pie. A probe is moved distally to visualize the semimembranosus tendon. The medial head of the gastrocnemius muscle belly. Rotate the probe approximately 90 degrees parallel to the semimembranosus tendon to obtain a long axis view. The semimembranosus muscle and tendon is a reliable landmark in this technique. The patient is instructed to perform isometric construction in knee flexion with the support of an assistant. The examiner holds the probe firmly so that it does not shift. If there is a lump lesion, a low echoic space appears below the semimembranosus tendon and the joint capsule. The medial meniscus left behind contraction of the semimembranosus muscle can be observed. We call this phenomenon the meniscus left behind sign. The arthroscopic findings from posterior medial portal view. During knee flexion, the posterior capsule shifts posteriorly, and the lump lesion widens. The difference between the injured and the healthy side can be clearly confirmed. Which is also one of the characteristics of ultrasound. Tips and tricks for this technique. Put probe just above semitendinosus tendon, knee flex to approximately 17 degrees in prone position. Move probe distally to visualize semimembranosus tendon and medial head of gastrocnemius. Rotate the probe approximately 90 degrees parallel to the semimembranosus tendon. Draw the medial meniscus in deep layer of the semimembranosus tendon. Instruct the patient to perform isometric contraction in knee flexion with the support and assistant. Check the meniscus left behind sign. Finally, compared with healthy side. Thank you for your attention.